Okay, so today we are going to be doing a female Foley catheter insertion. I would want to check for my provider's orders before entering the room. And then I would enter the room, make sure the door is shut behind me, perform hand hygiene. I would want to verify my patient's name and date of birth and compare that to their wristband. Once that is done, I would don clean gloves and perform perineal care from front to back. Discard those gloves, perform hand hygiene. I would want to make sure that I'm explaining to them what the procedure is going to be, that there might be a little bit discomfort, but it shouldn't hurt. From there, I would want to get my sterile Foley kit. I'm going to open it away from me first, then the sides, and then towards me. And I could touch the 1 outer inch of it. I'm going to grab my gloves. And don my sterile gloves. This is a blue drape. It goes between the patient's legs. You want to be sure to not contaminate your sterile gloves when doing so. But since I don't have a real patient, it's not going to stay. And you would want the shiny side down. This is another drape. You can use it or you don't have to. You can take it and place it over your patient. Move this over. Alright, so now I have alcohol swab sticks. I would want to open those and place them in my box so that they're easily accessible. From there, I could put a little bit of lubricant in the box as well. And I can go ahead and attach my saline that is going to inflate the balloon once the catheter is inserted. I would want to grab my catheter and go ahead and take this little plastic covering off, being sure that I do not let the end of the catheter fly away. Drop that. I'm going to stick this back in the box. And if I had an actual patient, I could put the box between their legs on that sterile drape. So I would want to put lubricant in my box and make sure I lubed the first 1 to 2 inches of my catheter. I'm going to take my sterile swab sticks and clean the outside, drop that one, grab another one, clean the inside, drop that, grab another one and clean down the middle and drop that. And then I would take my lubed catheter and begin to insert it. Let them know that they're going to feel a little discomfort. And I'm going to insert it 2 to 3 inches or until I see urine coming back. Once I see urine, I'm going to hold it with that hand and be sure to inflate my balloon. Once my balloon is inflated, I would want to gently give it a little tug and make sure that it is secured. Once that happens, I would want to take the bag and secure it to the patient. I could use a leg strap or tape. And then from there, I would just clean my patient and my supplies up and put them back in the lowest position and in a comfortable sitting position for them. And that is all.